Well, I think we might get started. We were expecting a couple more to show up, but hopefully they'll join us soon, but don't want to keep the rest of you waiting. So, hello, my name's Belinda. I have recently fellowed through the RACGP and MCCC at the start of 2020. And so I went through the MCCC training program and wanted to share with you a bit about my journey while giving you some information about the process generally with applying and training through the MCCC. So there's of the people here tonight, there are a few of you at different points in the process of thinking about and applying for GP training. So what I'm going to do is do the presentation that we've prepared, which gives a good general overview of the process, and then we'll have some questions at the end, and you've all sent through some good questions that I will try and address. Some very specific ones I can't address fully, but I will be able to get some answers for you through the right people in the MCCC. And yeah, if you have any more questions, if you could save them up to the end, or if you want to type them in the chat box, that Alex, our MCCC communications coordinator, is here with us tonight, and he'll be monitoring the chat box. So if you want to put your questions in there, and he will flag them with me at the end. So I might just minimize the little video there so that you can see all the slides. So getting on to it. So the MCCC is a training organisation that's defined by a geographical area, which is the Murray City, Country and Coast. So all the western half of Victoria plus the northeast and the north and western suburbs of Melbourne. So there's a lot of different practices in these areas, and a really good range to suit all different types of general practice that you might be interested in. The metropolitan places in Melbourne are always very popular. So I would encourage people to think outside of Metro, because there are some excellent training opportunities in the regions and rural areas. I myself did my training in Shepparton and Geelong, both really great practices, wide variety of presentations, really good exposure to all of the different areas of general practice. So even if you are living in Melbourne, certainly consider some of the other regions, because the popularity of the metro clinics is really high. So it can be difficult to secure a position in those clinics, but some of the great experiences can be found outside of that. So I'll move on to this slide that we've got about is general practice for you. I know some people have decided that yes, it is, and they're applying through the current AGPT application process at the moment. But some of you are still unsure, and so there's a few points on the slide here about what is important in general practice. The one thing that I would add to that is that GP covers everything in medicine. So if you're one of these people that enjoys surgery and pediatrics and women's health and geriatrics and all the things in between, then, and you're struggling to decide on it, well, what specialty might be for you, then general practice is great because it covers all of that. But the one thing that I think you need to be reasonably comfortable with is not knowing what to expect when your day is beginning and even halfway through, because you'll get the full range of presentations in just one day in general practice. And you might see a name on your appointment book in the morning and think, oh, that person will be coming in to talk about their diabetes, but then they'll come in with something completely different that you weren't expecting, and then you have to deal with that. So being able to handle the unknown is probably the most important thing in general practice, and managing uncertainty, because people do come in with some really different, unusual symptoms that don't fit in the textbook, and you've got to work out whether or not you can reassure them, or whether or not you need to investigate further or refer on to another specialist. So it's certainly challenging and interesting, and I don't think there's any one right reason why general practice is a good career for anyone. It's certainly a very flexible career, so you can make it whatever you want it to be. We'll go on to the next slide, which talks generally about the GP training program. So there's 2 intakes each year. So the first intake for the year is open now and closes next week, and there'll be another one later on in the year if you aren't in a position to apply right now. So you can apply from your intern year onwards, but I would encourage people to get as much experience as they possibly can in the hospital system before going out into general practice, because that experience is really valuable, and it helps you manage patient presentations in general practice a lot better when you have a few years experience in the hospital. So you can apply from intern year, but most people probably apply in their first year of residency, and then the 1 year in hospital is accredited towards your GP training. I'll talk about that a bit more in the next few slides. But I guess one of the points this slide is making is that you're never too old, never too young to apply, and you can apply to RACGP, which is probably the most common, particularly in Victoria, or ACRM, and you can actually apply to both as well if you want. And at this stage, the GP training is then delivered through the regional training organisations, of which MCCC is one. The other one in Victoria is the Eastern Victoria training program, which covers the rest of the state that wasn't covered by that map in the first slide. So this gives you a bit of an overview of how the GP training works. So once you have left the hospital, you are allocated to a clinic, and you do have a preference system where you can apply for clinics that you're particularly interested in. You're allocated to the clinic, and you have a supervisor there who works really closely with you initially, and then becomes more hands-off as you get more experience, so that you can become a fully independent GP by the end of the usually 2 years in general practice, but that varies quite a lot, and it is very flexible. So on the slide there, they say it's between 2 and 6 years. 2 would be the shortest amount of time that you could do it in, and that's having had your hospital time accredited already, because it really is a 3 years full-time program, and I guess the 6 years is referring to whether or not you do some of it part-time, or you do perhaps some extended skills on top of the basic GP training. And while you're in the practice, you get in-practice teaching by MCCC accredited supervisors, and there are some absolutely fantastic supervisors that we have with the MCCC and the clinics that they work in. And as well as that, you have release days to attend education sessions run by MCCC, which used to be all face-to-face, but thanks to COVID, had to pivot to online 100% last year. And this year they're back to doing a combination of both online and face-to-face. So I think that's a good mix, because certainly with all the face-to-face, people would move or would have to travel to certain areas to do the training, and there was a lot of driving involved in that. So that has certainly reduced that down. And yeah, the last point there, I think I've already covered the part-time training and leave options. There are a lot of policies surrounding that. I won't go into any of the detail because it's too much for this webinar. But if you're wondering about specific policies about, say, part-time training or maternity leave, things like that, then have a look on the MCCC website under the registrars drop-down box. There's a bit on policies and procedures, and all of the procedures that govern how things work with the registrars is on their website. But you can also ask specific questions to MCCC if your scenario doesn't fit with what's on the website there. So there's a few options for GP training, as I've already mentioned. So the one I'm most familiar with is the RACGP, which is on the right-hand side of the screen there. So usually with that, you do 12 months of hospital training. If you apply in your intern year, then your residency year is counted as that before you then move out to GP training terms 1 and 2, which is 12 months. Then you usually sit your exams, do GPT 3, which is 6 months, and then an extended skills or further term in general practice if you prefer before your fellow. And then there's the options if you're looking at doing rural generalist pathways of doing further advanced skills to perhaps do emergency medicine or anesthesia or something like that, that would be helpful in your rural generalist role. And obviously that is tied to rural placements, not the general stream. ACRM is a slightly longer program, and because you have the advanced skills there, which is mandatory, whereas that's not necessarily mandatory in the RACGP program. And the rural generalists usually have extra additional skills or advanced skills that they can do before fellowing to, I guess, broaden the range of things that they're accredited to do when they finish. So this is just sort of talking about a similar thing. There's lots of different options for GP training, so you can really tailor it to your interests and your lifestyle and what you want to get out of general practice. So when you have been accepted onto GP training, you then get the choice of general pathway or rural pathway. That does depend somewhat on the entrance tests that you sit with the situational judgment test and the interview. So my understanding is that you can choose either if you score highly on those, but the lower ranked you are in those tests, the less choice you may have, and tend to be allocated the rural pathway if you've got one of the lower ranks. So the general pathway, you can train anywhere within MCCC, though usually the general positions are places in Metro Melbourne and Geelong. And you can only train in the rural places if there is positions that haven't been taken up by the rural registrars. This sort of detail is all something that you don't need to worry about when you're applying or even thinking about applying, but it is important to be aware of, because if you are living in Melbourne and wanting to continue to work in Melbourne, you need to know to pick the general pathway. You can't do the rural pathway, obviously, and work in Melbourne. And usually you can't transfer across the two regions once you've chosen the pathway that you're on. You stay on that. There's always exceptions to the rules, though. Myself, I was on the general pathway training in a clinic in Geelong, which is not classed as rural, but we had to move to Shepparton for my husband's work, and so I had to make an application to MCCC to be able to transfer to Shepparton, which is in the rural pathway footprint area. Because they had vacancies in the area, I was able to complete my training in Shepparton, still as a general trainee, but in a rural clinic, if that makes sense. So yeah, if anyone's got questions about that later, I can go into a bit more detail, but yeah, you don't need to worry about that detail so much at the moment, but certainly be thinking about the areas that you want to work in now, so that you know what pathways you need to be applying to once you're accepted by the AGPT. There are a few eligibility criteria which you go through when you're applying, so you've probably already done that if you're applying this intake. And then there's last little bit there about considering advanced skills. It's mandatory with ACRM, and there's lots of different options. They say optional with RACGP. I think most registrars take up the option, and there's a lot of great opportunities. So there's academic posts where people work with departments of rural general practice to work in education and research. There is registrar medical educator positions, where registrars actually spend time with the medical educators in MCCC developing content for the workshops and online teaching. There is palliative care, obs and gynae. I did mine in emergency medicine, and that I actually did before I left the hospital system. So there was a question that came in from one of you about whether or not you can do your extended skills before you leave the hospital, and you can in certain scenarios. It does depend on what the extended skill is, and has to be approved by the MCCC well in advance. But if that's something that you're thinking of doing, talk to the MCCC once you're in the program, and they will help you sort that out. They were really helpful to me because once I was in the program, even though I'd already worked for 5 years in the hospital, I didn't have the rotations required for GP. I'd mostly done surgical rotations, and I needed to have peds and obs and gynae. So I then spent another 12 months in the hospital, and as part of that I did 6 months as an emergency registrar and completed the emergency medicine certificate through the College of emergency medicine. So that was my extended skills, and that was done before I went into general practice. And that was a really useful experience because it certainly made things easier to manage once I got into GP. So that's just one of many options that people have with extended skills. All right, so this is another really technical area that I won't go into much detail, but basically the recognition of prior learning depends on when you actually apply for the GP training program. So if you apply as an intern, then and you get onto the program at that point, all of your time after that counts towards your GP training. So that's fine. You don't have to worry about RPL. But if you have done a few years in the hospital, have done the required terms like PEDS and O&G and whatever else you need to do, then you apply for GP training, you can apply to have those previously completed hospital terms counted towards that first year of GP training. You do have to write an application form. It's kind of like an essay about what you learned in your rotation and how it's going to help you in general practice. It's not onerous, but it's just part of the process to have that time recognised. So that can be done so that then say you apply now, you get accepted on later on this year, you do your RPL, and then you can start in general practice in February next year. You don't then have to spend another year in the hospital if you don't want to, if you've already done everything that you need to in the hospital before you start. And it's a similar process for ACRM as well. They just have different acronyms, which is the Hospital Experience Assessment. So I'll keep going, but if there's any more questions about that, we can talk about that at the end. This slide is about why you should choose the MCCC. I think a lot of registrars do pick the training organisation based on the location they live and want to work, and that's obviously makes sense because that's how the system is set up. But if you are living on the border between EVGPT and MCCC, then you might want to think about, well, what else does the MCCC offer that maybe you can't get elsewhere? And certainly the medical educators that work with the MCCC are excellent and constantly reviewing and refining the education that they deliver to registrars, and really take pride in what they do. The supervisors, as I mentioned before, some are really excellent. They have lots of strings to their bows. There's GP supervisors that are advocates for general practice with RACGP, as well as doing their medical education work and make podcasts and all sorts of different things. So some really fantastic people to work with. MCCC covers a really diverse range of clinics that you can work in, and certainly a wide variety of patients that you'll treat, and obviously that does vary quite a bit geographically, but you can really get a broad experience through the training with the MCCC. And the other thing that I really enjoyed with my training is the support that you get from the other registrars. So MCCC really sets you up to get to know the other registrars that you're training with from the very beginning, so that you can have your own support group as you go through your training and into exams, which is invaluable. And so even though I had to move away from the registrars that I originally trained with in Geelong, I still kept up with them with exam preparation, and even now as new fellows, so sort of comparing notes and how we're going. And I found that really useful, and that was all supported with the MCCC. So this is just a bit more about the rural generalist training. So MCCC can help with the extended skills that you do for that, the placements in the clinics that are attached to the hospitals that allow you to do the rural generalist work. It's, I guess, a much more diverse and sometimes more acute than what you might be dealing with in general practice otherwise. So if you're interested in working in some of these more rural areas of Victoria, encourage you to look into the rural generalist training, because you can really expand your GP career by doing this. And a few quotes from registrars on the slide here about working in a rural community and the benefits of doing that. So obviously MCCC covers quite a broad rural area, and the thing that I found with working in Shepparton, even though it's not particularly rural, certainly serviced a lot of the rural communities around the town, in that you got to know the patients at a much deeper level, because patients always came back to your clinic. They weren't ducking down to the bulk billing clinic down the road because you know, it was quicker and easier for them, which is certainly something that you might find in Melbourne or bigger towns. So you really get to know your patients, and some of them can be really complex, and you can really make a difference in their lives. So it can be a lot more rewarding to work in rural areas. So I think this is the last slide now, which has got some places you can go to get further information. So the email address there is manned and checked regularly, so someone will get back to you if you email any questions there. There's a hotline there, and also for more general information, you might like to follow us on some of our social media pages, because there's always information going up there to make registrars and pre-vocational doctors aware of what's happening within the MCCC. And obviously there's the website as well, which, like I mentioned before, has all the policies and procedures available black and white there, so you know what to expect with the MCCC. So I might take some questions now. I might put the video back up and just have a look at the chat box. So yeah, certainly I think you'll be able to write your questions in the chat box if you've got anything, or you possibly will be able to unmute yourself and ask any questions. Some of the questions that we got through before the webinar tonight were about exemptions to the 19AB or 10-year moratorium, about where you can train, and spousal exemptions and that sort of thing. I can't give you much detail on that, other than to have a look at the Australian government website, health.gov.au, or if you just Google 19AB exemption, it goes through what you have to do to be eligible for that. And you can apply for that, and MCCC can guide you if you need help with that. But my understanding is that's a separate thing to MCCC, so you would need to apply for that separately, but MCCC can certainly offer some guidance with that if you need. So have we got any other questions at the moment? Yes, so the number of places does vary from year to year, and it depends a lot on what's happening with the registrar's training from the previous year. So I can't give you exact numbers with how many are in the Metro West region. Because, yeah, like I said, it does vary from year to year. So if there's registrars that don't pass their exams, or they take maternity leave, or a whole host of reasons, that does reduce the places available for incoming registrars. But what I would say is to anyone that is applying, not to rely, if you live in Melbourne, not to rely on being able to get a Metro West place. They are certainly limited and very popular. You'd certainly need to be in one of the higher ranking bands, so 1 or 2 with their entrance tests, to be able to be guaranteed of one of those places. So if you do live in Melbourne, encourage you to have a look at some of the outlying regions. Certainly, there's a lot of places that are commutable from Melbourne, or if it's feasible for you to even think about relocating, because, and I know people with families and spouses working in Melbourne, that's not always an option, but if it is, it's certainly worth considering, particularly after COVID. I know a lot of people are doing the tree change thing, moving out of the city to get, you know, more space and better lifestyle and that sort of thing. So certainly worth considering. If you can move to some of the outer Melbourne places, then you certainly have a better chance of securing where you want to go. Any other questions at the moment? Thanks, Emma. I'm glad it was helpful. Yeah, and if you do have any other questions that you think of later, feel free to email us or call us. And yeah, I've always found the team at MCCC really helpful in getting each individual what they need to know to help them into the program and out the other side. So I guess if there aren't any more questions at the moment, we might leave it there. Thanks very much for coming along, and good luck with your careers, whether that be in general practice or otherwise. But I hope this has helped you make some decisions, or help you with your application if you're already in that process. So good luck.